The Biden-Harris administration, through the U.S. Department of Health and Human Services, is pleased to announce the release of the 2024 National Strategy for Suicide Prevention and the first ever federal action plan. Suicide is an urgent and growing public health crisis. Every year, millions of people think about, plan, or attempt suicide. More than 49,000 people in the United States died by suicide in 2022. That's one death every 11 minutes. The National Strategy and the Federal Action Plan offer a renewed focus and comprehensive, whole-of-society approach to suicide prevention. The 2024 National Strategy will guide our approach to suicide prevention over the next decade and is a direct response to the changing landscape and trends in suicide and suicide prevention. This coordinated and comprehensive approach to suicide prevention at the national, state, tribal, local, and territorial levels relies upon critical partnerships across the public and private sectors. People with lived experience are critical to the success of this work. We call upon all our partners to join us in taking action to prioritize suicide prevention efforts across our country. Our call to action is urgent. It's more than just words. It's a commitment to care, connect, collaborate. Care. Caring about suicide prevention requires a thoughtful strategy and the intersection of prevention, intervention, and postvention supports. Connect. Connecting to community and culture are key protective factors for health and well-being, including protecting against suicide risk. And collaborate. A comprehensive approach relies on collaboration with public and private sector partners, people with suicide-centered lived experience, and people in populations disproportionately affected by suicide and suicide attempts. There is both an urgent need and unique opportunity to make significant and measurable progress around suicide prevention in the United States. Now's the time to act decisively to eliminate suicide risks and promote healthy and more resilient communities across the United States. Given the urgency, the Substance Abuse and Mental Health Services Administration, Centers for Disease Control and Prevention, along with the National Action Alliance for Suicide Prevention, led the development of these critical deliverables. Working together as partners alongside states and communities and people with lived experience and those most impacted, we can address the many factors increasing suicide risk and promote well-being. The National Strategy seeks to prevent suicide risk in the first place. It incorporates advances in the field and addresses emerging issues like social media and equity. It focuses on addressing the many risks and protective factors associated with suicide, with the recognition that there's no single solution to this complex challenge. In the Federal Action Plan, over 20 federal agencies have identified more than 200 actions to be taken over the next 3 years in support of those goals. In 2024 alone, agencies have committed to things like expanding suicide risk screening across Indian country, improving 988 data collection, and developing resources to help communities implement strategies to reduce suicide risk in the first place. There's power in our collective action. Together, we must act to prevent suicide and to promote healthy and resilient communities across the United States. Join in these efforts to care, connect, collaborate. Everyone has a role to play in preventing suicide. Hope is possible.